Welcome. Welcome to Consumers Doctors channel. Today's topic is uninsured Americans. There are 27 million uninsured. Out of those 27 million folks, you believe it or not, 90% of them can get health insurance. They can afford it, but they don't want to. This is where the problem is. Not because they can't afford it. They don't want to waste money in buying health insurance. You know why? Because they're healthy. They don't go to see the doctor. They don't go to the hospital. But they don't realize it is a wrong choice. Yes, it is a wrong choice. I'll tell you why. If you're individual or a family, and you're in 30s, mid-30s, your parents have parental coverage is gone, mid-30s, 40s, better you buy health insurance. You know why? If you get a high deductible health plan, so-called go to Covered California, any insurance, select a high deductible health plan, you can lower your premium to $50, folks. I'm not kidding. $50. You mean to tell me that you cannot afford $50 a month for your health insurance? It has more pros than cons. I'll tell you why. By getting a high deductible health plan, your health insurance premium is lower. What it does, it qualifies you to health savings accounts contribution. The health savings accounts, which started in 2004, not many Americans are aware of it, but slowly now, almost large employer groups, all of them have health savings account. Only problem is the smaller employer groups are not providing that option because these mom and pop restaurants and doctors' offices, small business, they just can't afford it because they are paying so much premium into the workman's comp. Can you believe it? Workman's comp is meant for the attorneys. Basically, attorneys are benefiting from workman's comp more than anybody else. I'll tell you why. Because if you include a health insurance, you are benefiting. You need to call your congressman and senator, tell them, I want a health insurance rather than a workman's comp insurance. Workman's comp insurance, I'm not sure. You can still have protection, but there are ways to do it, folks. Health insurance is so critical for individual and families. If small employer groups, so-called smaller employer groups, under 50 employees, they can be grouped together. They can be grouped like Amazon or Google employees. They can purchase the same insurance policy like Google employees and Amazon employees. Once you have that, once you get this high deductible health plan, your employer should be able to afford to pay for this group policy, which will cover you and your family. If there's one family member who is really sick and is an outlier, you can separate him. What it does is, if one person in the family is an outlier, there's a thing called Health Review Authority. Health Review Authority is under the public-private partnership. They will issue a certificate of guaranteed coverage for folks that are physically impaired, economically impaired. They cannot buy health insurance. But the rest of the folks, guys, who are self-employed, working for a small mom and pop, your employer should be able to afford high deductible health plan, and the contributions to the health savings has to be mutual between you and your employer. That is a mutual agreement which is good for the employer to contribute health savings because all the employees feel like they belong to that company. Yes, that's the way to go, folks. This so-called healthcare is going in the wrong direction. I believe the time has come. You folks out there, all consumers, all Americans need to be empowered so you can make the right choice. Because when you have enough funds in your health savings account, folks, you have your own debit card or whatever it is, you can use the cards to pay as you go. It's not like you, and consumers will demand affordability. Consumers will demand competition. Consumers will demand transparency. Right now, as I see it, hospitals are consolidating. Doctors are consolidating. They're driving away the competition. That's not the right way to do it, folks. We need more competition. We need affordable health insurance premium. We need affordable surgeries. Yes, surgeries. The technology will lead the way where the consumers. Right now, the point of care, folks, believe it or not, it is not in the hospitals. It is not in the doctor's offices. You're mistaken. If you think this is in the doctor's offices or hospitals, you're mistaken. It is right at home. Point of care is right at home. We will have good old days if a doctor needs to see you personally. Yes, majority, 90% of the time, doctor can take care of you with all these sensors, what we have, portable devices. He can get all the data what he needs to take care of you. There's a 10% chance he may have to visit you. Those folks, doctors will pay the visits like good old days. You remember in 1900, doctors used to make house calls. The time has come for the house calls. Yes, 90% of the time with telemedicine, you can prescribe a medication, you can get your pulse, blood pressure, your heart rate, your echo, you name it, folks, your carotid Doppler. There are lots of ways to get the information from the patient. They don't need to be seen. Having a doctor's offices is a moot issue, folks. Having a doctor's office is a receptionist and a medical assistant, billers. Those days are gone, man. Those days are gone. Better all of you wake up. Consumers, doctor is telling you, you need to be empowered and you need to demand transparency. When you go to the hospital, when you go to the urgent care, if they ask you for the insurance, how much is it anyway? I need to know before I give you my card. Yes. Don't give your insurance card just like that. How much is this visit going to cost me? Don't give away just the card, because they're going to bill you in the back end without your knowledge. They have no right to bill your insurance without your knowledge. Are you getting my point, folks? This is the way healthcare should be. Consumers demand transparency for every procedure, every hospital visit. Even when you're in the hospital for 3 days, 4 days, 10 days, it doesn't matter. Before you're discharged, you're supposed to get a bill. You're supposed to receive a bill. You need to sign off on the bill before they bill your insurance. That's the way. That's the norm. But that's what not is happening, folks. That's why the healthcare keeps rising and rising. We have spent $3.8 trillion. Can you believe no other country on earth has spent that kind of money? Most of the countries, they spend 8%, 6 to 8% of the GDP. You know how much America spends on the GDP? It's a joke. 18%. It has surpassed the national defense budget, folks. It's shameful. It is shameful because you know why? You're not in charge. These insurers or insurance companies are not interested in lowering the cost. You need to get involved, be proactive, demand. how much is this? What is it going to cost me? Before you bill my insurance, ideally, you should sign off before they send you the bill. They send the bill to the insurance. That's the way it should be. Thank you, folks. Thank you for listening. If you like this channel, do subscribe, share. I'll come up with some brilliant ideas. Brilliant ideas, folks. Pretty soon, you should go to dollarcare.org. Under the nonprofit umbrella, I'm seeking donations. I'm trying to address the issue of healthcare delivery to all you folks. It can be done. We're going to set up virtual clinics online. We will, under the nonprofit umbrella. You can see a doctor under dollarcare.org. That's my intention. Folks, I would love to receive donations, and I would love to receive whatever you can afford, because this is my lifetime passion, folks. I've been in healthcare for too long. I'm seeing the healthcare needs to go in the right direction. If America needs to be number one in healthcare, consumers can make that happen. Nobody else. Not even a government, not insurance companies, not government regulations, bureaucracy. This Medicare is a joke. They need to be taken away. Department of HHS give you the funds to buy the insurance of your choice rather than putting in the pockets of the middlemen. All these billing companies, middlemen, managed care organizations, they need to go away. That's not the right way to handle the healthcare. Give the power back to the consumers. They will bring down the costs. Thank you for listening. I love you. We will see you next time. Goodbye and God bless.